Maternal newborn labor pain management quiz with rationales. Question 1. A patient who is older than 35 years may have difficulty achieving pregnancy because Option A. Pre-pregnancy medical attention is lacking. Option B. Personal risk behaviors influence fertility. Option C. Contraceptives have been used for an extended period of time. Option D. The ovaries may be affected by the normal aging process. The correct answer is Option D. The ovaries may be affected by the normal aging process. As women age, their ovarian reserve decreases and the quality of their eggs declines, making it more difficult to conceive. Question 2. A nurse is reviewing the prenatal laboratory results. To feed. Option A. Have the mother lean over the infant while feeding action, to facilitate gravity, thereby creating enhanced. Option B. Platelet count of 300,000 per Z1/4 L of blood milk flow. Option C. Red blood cell count of 4 million/microliter. Option D. Breastfeeding should not be attempted at this time. The correct answer is Option B. Platelet count of 300,000 per Z1/4 L of blood milk flow. Platelets are essential for blood clotting and preventing excessive bleeding. Question 3. Which client would be at greatest risk for developing? Option A. Thick breast cancer. Option B. Wet/slippery with egg white consistency. Option C. Client who had her first baby at the age of 24. Option D. Client who did not breastfeed. The correct answer is Option D. Client who did not breastfeed. Not breastfeeding has been identified as a risk factor for developing breast cancer. Question 4. As the infant nursery nurse, you are assisting with A. Option A. Assess the fetal station delivery. After the initial assessment of the baby. Option B. Assess for rupture of the fetal membranes. What is the next best action? Option C. Determine dilation of the cervix. Option D. Give the infant a bath. The correct answer is Option C. Determine dilation of the cervix. For correct answer, C. Determine dilation of the cervix 1. Question 5. A nurse is providing teaching to a group of women about risk factors for ovarian cancer. Which of the following should the nurse include? Select all that apply. Option A. Nulliparity. Option B. History of breastfeeding. Option C. Previous use of oral contraceptives. Option D. History of breast cancer. The correct answer is Option A. Nulliparity. In educating women about risk factors for ovarian cancer, it is crucial to provide accurate information to promote awareness and early detection. Question 6. A nurse is caring for a client who is in labor and has a diagnosis of Group B Streptococcus B hemolytic infection. Which of the following medications should the nurse plan to administer? Option A. Ampicillin. Option B. Azithromycin. Option C. Ceftriaxone. Option D. Acyclovir. The correct answer is Option A. Ampicillin. Ampicillin. Group B Streptococcus, GBS, infection during labor is typically treated with intravenous antibiotics like ampicillin to prevent transmission to the newborn. Question 7. In planning sex education classes for the middle school age group, more emphasis should be placed on Option A. How to set limits for sexual behavior. Option B. The inaccuracy of information from peers. Option C. The use of oral contraceptives to prevent unwanted pregnancy. Option D. The use of condoms to prevent sexually transmitted diseases as well as pregnancy. The correct answer is Option D. The use of condoms to prevent sexually transmitted diseases as well as pregnancy. Because emphasizing the use of condoms is crucial for preventing both sexually transmitted diseases and pregnancy among middle school students who may engage in sexual activity. Question 8. A mother is learning how to breastfeed her newborn. Shins, moderate variability. The lactation nurse is assisting her with this process. Option A. Baseline FHR 140, occasional variable decelerar. Which technique is correct? Shins, moderate variability. Option B. Have the mother stroke the infant's mouth with. Option C. Baseline FHR 105, no accelerations, recurrent her nipple so the infant will turn toward the variable decelerations, minimal variability mother's breast for feeding. Option D. Baseline FHR 165, no decelerations, marked. The correct answer is Option B. Have the mother stroke the infant's mouth with. Having the mother stroke the infant's mouth with her nipple so the infant will turn toward the mother's breast for feeding is the correct technique when assisting a mother in. Question 9. A patient is trying to learn the cervical mucus detect lung development. Shin natural family planning method. The patient, Option A. Risk for dysfunctional gastrointestinal motility, understands that which type of cervical mucus is related to birth before 38 weeks gestation the most fertile. Option B. Activity intolerance related to early gestational age. Option C. Scant. Option D. Purulent. The correct answer is option C, scant. In the cervical mucus detection natural family planning method, the type of cervical mucus that is related to the most fertile period is commonly described as egg white. Question 10. Which circumstance is most likely to cause uterine partum assessment with a woman who is 4 days atony and lead to excessive blood loss? Option A, orthostatic hypotension. Option B, involution of the uterus. Option C, urine retention. Option D, after pains. The correct answer is option A, orthostatic hypotension. Orthostatic hypotension, which is a sudden drop in blood pressure upon standing, can result in decreased perfusion to the uterus, leading to poor contraction of the uterine. Question 11. A nurse is caring for a client who is receiving oxytocin to augment labor. The client has an intrauterine pressure catheter and an internal fetal scalp electrode for monitoring. Which of the following is an indication that the nurse should discontinue the infusion? Option A, contraction frequency every 3 minutes. Option B, contraction duration of 100 seconds. Option C, fetal heart rate with moderate. Option D, variability fetal heart rate of 118/min. The correct answer is option B, contraction duration of 100 seconds. Prolonged contractions lasting more than 90 to 120 seconds may reduce placental perfusion and oxygenation to the fetus, leading to fetal distress. Question 12. A nurse is caring for a client who is in labor and has an epidural for pain control. Which of the following clinical effective epidural anesthesia? Option A, polyuria. Option B, hypertension. Option C, pruritus. Option D, dry mouth. The correct answer is option C, pruritus. Epidural anesthesia can result in some common side effects, one of which is pruritus itching. Question 13. Which factor is a major barrier to healthcare for adolescent mothers? Option A, healthcare workers have a positive attitude. Option B, the hospital or clinic is within walking distance of the girl's home. Option C, seeing a different nurse and/or hilghcabri, picrometer at every visit, USNTO. Option D, the institution is open days, evenings and Saturday by special arrangement. The correct answer is option C, seeing a different nurse and/or hilghcabri, picrometer at every visit, USNTO. The major barrier to healthcare for adolescent mothers is seeing a different nurse and/or healthcare provider at every visit. Question 14. Visions before finding one that works. Option A. Once you take the prescribed medication, you plan on teaching this client, will be cured of the infection. Option B, breastfeeding. Option C, even though you don't experience symptoms. Option D, postpartum depression, you can still spread the infection. The correct answer is option C, even though you don't experience symptoms. Is the most appropriate statement to make to the client because it addresses the reality of sexually transmitted infections, STIs. Question 15. Placental circulation is dependent on maternal circulations for preventing sudden infant death syndrome? Laschen. In which maternal circumstances is placental select all that apply? Circulation impeded? Select all that apply. Option A, position newborns in the prone position to. Option B, hypotension. Option C, preeclampsia. Option D, avoid soft bedding or pillows in the newborns. The correct answer is option B, hypotension. Hypotension. Hypotension in the mother can result in decreased blood flow to the placenta, affecting placental circulation and oxygen delivery to the fetus, increasing the risk. Question 16. A nurse is teaching a prenatal class regarding false labor. Which of the following information should the nurse include? Option A. Your contraction will become more intense when walking. Option B. You will have dilation and effacement of the cervix. Option C. You will have bloody show. Option D. Your contraction will become temporally regular. The correct answer is option D. Your contraction will become temporally regular. False labor, also known as Braxton-Hicks contractions, are contractions that are irregular and do not lead to cervical dilation and effacement, unlike true labor contractions. Question 17. A nurse is caring for a client who is experiencing sore nipples from breastfeeding. Which of the following actions should the nurse take? Option A, place a snug dressing on the client's nipple when not breastfeeding. Option B, ensure the newborn's mouth is wide open before latching to the breast. Option C, encourage the client to limit the newborn's feeding to 10 minutes on each breast. Option D, instruct the client to begin the feeding with the nipple that is most tender. The correct answer is option B. Ensure the newborn's mouth is wide open before latching to the breast. Ensuring the newborn's mouth is wide open before latching to the breast is the correct action to take when caring for a client experiencing sore nipples from breastfeeding. Question 18. A nurse is reviewing the laboratory results for a client who is at 29 weeks. The provider: option A, WBC count. Option B, 11,000/mm superscript 3 hemoglobin. Option C, 11,2g/dl. Option D, HCT 34% platelets 140,000/mm superscript 3. The correct answer is option B, 11,000/mm superscript 3 hemoglobin. 11,000/mm superscript 3 hemoglobin. At 29 weeks of gestation, hemoglobin levels are crucial to monitor for anemia in pregnant women. Question 19. Which congenital defects in a newborn are associated with long-term parenting problems? Select all that apply. Option A, polydactyl. Option B, cleft lip and palate. Option C, ventral septal defect. Option D, ambiguous genitalia. The correct answer is option B, cleft lip and palate. 1. Cleft lip and palate. Parents of a newborn with a cleft lip and palate may face challenges related to feeding difficulties, speech development issues, and concerns about. Question 20. A client who is in the second trimester of pregnancy, gestation. The client is receiving magnesium sulfate tells the nurse that she has developed a reddish pink intravenously for preeclampsia. Which assessment skin color on the palm of her hands? Which of the fall requires immediate intervention? Option A, blood pressure of 130/90 mmHg. Option B, urine output of 20 ml in past hour. Option C, facial flushing. Option D, patellar reflexes 2+. The correct answer is option C, facial flushing. Facial flushing in a pregnant client receiving magnesium sulfate for preeclampsia can be a sign of magnesium toxicity. Question 21. Which foods control option? Which is the most effective and should she discuss? Option A, whole grains. Option B, copper intrauterine device. Option C, meats. Option D, cervical cap. The correct answer is option B, copper intrauterine device. Among the options provided, the most effective birth control method is the copper intrauterine device, IUD. Question 22. A nurse is providing teaching about expected changes during pregnancy to a client who is at 24 weeks of gestation. Which of the following information should the nurse include? Option A. Your stomach will empty rapidly. Option B. You should expect your uterus to double in size. Option C. You should anticipate nasal stuffiness. Option D. Your nipples will become lighter in color. The correct answer is option B. You should expect your uterus to double in size. You should expect your uterus to double in size is the correct information to include when discussing expected changes during pregnancy at 24 weeks of gestation. Question 23. A nurse is caring for a client who is receiving prenatal care and is at her 24-week appointment. Which of the following laboratory tests should the nurse plans to conduct? Option A, Group B strep culture. Option B, 1HR glucose tolerance test. Option C, rubella titer. Option D, blood type and RH. The correct answer is option D, blood type and RH. At the 24-week prenatal appointment, it is essential to conduct a blood type and RH test for the pregnant client. Question 24. A nurse on a labor and delivery unit is providing teaching to a client who plans to use hypnosis to control labor pain. Which of the following information should the nurse include? Option A, focusing on controlling body functions. Option B, synchronized breathing will be required during hypnosis. Option C, hypnosis can be beneficial and you practiced it during the prenatal period. Option D, hypnosis does not work for controlling pain associated with labor. The correct answer is option C, hypnosis can be beneficial and you practiced it during the prenatal period. The correct information that the nurse should include is that hypnosis can be beneficial if you practiced it during the prenatal period. This statement is true because. Question 25. Many teens wait until the second or even third trimester to seek prenatal care. The nurse should understand that the reasons behind this delay include which of the following? Select all that apply. Option A, continuing to deny the pregnancy. Option B, uncertainty about where to go for care. Option C, lack of realization that they are pregnant. Option D, a desire to gain control over their situation. The correct answer is option A, continuing to deny the pregnancy. Continuing to deny the pregnancy. This is because some teens may struggle to come to terms with their pregnancy and deny it, leading to delays in seeking prenatal care.